OK, we now have a new timeline for the rollout of the soon-to-be-approved COVID-19 vaccines in this country. Now, the Prime Minister said today the first recipients would receive their jabs as early as mid to late February. GPs will be involved in the process as well, but we're being warned that the vaccine will not be a silver bullet. It comes on a day in which both New South Wales and Victoria recorded no new overnight infections. I caught up with Federal Health Minister Greg Hunt late this afternoon. Minister, thank you very much for your time.
Pleasure.
Now, the rollout timeline seems to shorten by the week. How has the Prime Minister managed today to tell us that it may happen as early as next month?
Well, we've always been working on a cautious basis of making sure that, firstly, we were protecting the safety of Australians, but secondly, we were maintaining confidence by meeting and beating all of our deadlines. And as we've been able to ensure the data and the evidence from the vaccine makers, as we've been able to ensure that the Therapeutic Goods Administration can do its assessment, that the vaccines can be delivered on the time frame, that the batches can be tested, as each one of those has been ticked off, then we've been able to come forward. We've now settled on the final time frame of mid-February to late February, and that means that we can have confidence. Next month, the vaccine program begins. It will then ramp up during the course of March. And what Australians, I think, will be heartened to know is we've done this by maintaining the most rigorous safety structures and testing and assessment process in the world. And that gives confidence, and that means a higher take-up, and a higher take-up means better coverage, better protection for Australia.
So briefly, what's the TGA waiting for? Is it what to work out from the rollouts in the UK and the US, side effects, etc.? Are there things that they're not aware of that they're waiting for?
Yes, so they have more evidence that's coming in directly from both of the first vaccine providers, being Pfizer and AstraZeneca. Both companies are doing a fantastic job. But what's occurred overseas, and I think this is really important context, is where there has been the agony of tens of thousands of cases a day, 60,000 cases in the UK today, and 1,000 lives lost. Over 200,000 cases and 3,500 lives lost in the US. Other parts of Europe that are suffering the darkest of winters. They've taken an emergency decision that they've got to proceed with the vaccination program, which we understand. Those countries that have had the privilege of being highly successful in containing the virus, Australia, New Zealand, Japan, Korea, and also a jurisdiction such as Taiwan, we're all in a similar time frame of mid-February through to early April, and they're the countries that have been fortunate to act early, develop systems, but also to expedite the vaccine assessment process, but make sure that it's a full, absolutely clear safety process. And I think that just provides confidence to the Australian people.
As we get into March, April, May, and people are able, under their own category, to receive the jab, will they be just going to the GP to get a jab? How will this work?
We'll be able to do this through state vaccination clinics, Commonwealth vaccination clinics, hospitals, as well as through the GP. And the General Practice Network will be an absolute cornerstone of the rollout of the AstraZeneca vaccine, the Pfizer vaccine through the hospitals, because that requires the minus 70-degree cold chain logistics, the AstraZeneca vaccine, conventional vaccine, and in the same way that the flu jab can be delivered by the GPs, so will the AstraZeneca.
What are you being told by the Chief Medical Officer about the percentage that we need to receive the jab? Do we need 75% of the population? Is it more effective at 85%? Is it useless at 60%?
So the goal is as high as possible, and herd immunity is generally perceived to be between 60 to 66% of the adult population for a condition such as this. But we're going to try to get as high a number as possible, and I want to encourage Australians, bring yourself forward, because it won't just protect you, it will also protect other vulnerable Australians, and it will also give us a greater pathway to more freedoms.
Now, Minister, did I hear right today from the Prime Minister that there'll be some kind of televisual ceremonial jab given to you and the Prime Minister and all of Cabinet so we can all see you receive the pain?
Look, I'm very happy to do it. I think every year I go and get the flu vaccine early, and in some way, shape or form that's highlighted. What we're likely to do is to have a very bipartisan approach, the Prime Minister, the Leader of the Opposition, the Health Minister, the Shadow Health Minister, not aiming to do the whole of the Cabinet. We don't want to be queue jumping. Right. It was quite a sensitive issue, if I'm being very honest. We didn't want to queue jump, but at the same time we wanted to provide confidence. So I spoke with Chris Bowen in December. He was great. We just focused on the idea of key leaders on different sides of the parliament doing it together, but not giving any special priority, because there's no medical reason for it, to either the Parliament or the Cabinet.
Let's tell our viewers what it means, though. This is not a silver bullet. We could be, at this point in 12 months' time, with clusters still in our capital city and needing to social distance as much as we're doing now, right?
Well, I think what we'll see is progressive improvement during the course of the year and a progressive decrease in any of those impositions on our freedoms, and that's our goal. But the Chief Medical Officer, Paul Kelly, has said today, and the Prime Minister reaffirmed, that this won't suddenly go away. We don't have the data yet. The world doesn't have the data yet on the transmission control of the vaccine. The safety, the efficacy is looking very, very good. The world, doesn't yet know how many variants there will be, how many changes in the strains. And so those are things that we'll have to monitor. But over the course of this year, what am I very confident of? There'll be a very high and growing uptake of the vaccine. There will be far greater protection of Australia, and in turn, that means there'll be greater freedoms for Australians. And it won't be absolute. There will be things that we have to watch in a world with 750,000 cases a day, but continuous improvement. And then when we have to take steps to address an outbreak like Avalon, or as we've seen in Victoria, both of which are at 0 cases today, then we do it. We know how to do it. We'll continue to do it. And sometimes we'll have to take a step back, but all up, we'll be travelling forwards, and very clearly travelling forwards. Yeah,
good donuts today, good numbers. Now, I want to ask 2 quick questions. Are you hoping that after tomorrow's National Cabinet meeting, we will have in place a no test, no fly rule?
Look, I know that the medical expert panel led by Professor Paul Kelly has been meeting yesterday and today. I've been engaged in the vaccine work this afternoon, so I don't have the results of that. They'll brief the National Cabinet. I respectfully don't have, but nor would I preempt the National Cabinet, because that will go to the leaders. And I know that tomorrow the Prime Minister and Professor Kelly are likely to address the nation.
OK, and finally, the IT industry has written you a letter saying your blind spot could be the use of IT technology in the way you roll out the vaccine. Is that a blind spot for government?
Well, we've been deeply engaged with the sector. We've had a process to ensure that we're putting in place an interlinked national system. The Australian Immunisation Register already exists. But we've reached out to the particular author today. I know that the Chief Information Officer of the Department of Health, Daniel Keys, was doing that. And if it's not today that they've actually made contact, it will be in the course of the next 24 hours. So we're very happy to work with others and appreciate their input. Australians have been magnificent, whether it's been pathologists, IT, researchers, our doctors, our nurses, or everybody presenting themselves for testing. And so, at the end of the day, what's my takeaway? We've been safe and we've protected Australians, but this is a good country. This is a very, very good country.
A day of reassurance. Thank you so much for your time, Greg Hunt.
Thanks, Chris.